Welcome to Elevate Care. I'm your host, Carrie Perez, and I'm joined here today with Dr. Danielle McCamey. We are really excited to talk about mentorship, leadership, diversity in nursing. Dr. McCamey, welcome to the show.
Thank you for having me, Carrie.
Awesome. So happy to have you. Before we get started, can you tell us a little bit more about you and your background?
Yes, absolutely. So my name is Dr. Danielle McCamey, and I love this question because I'm like, how can I come up with a little bit of flair outside of just naming my entire resume? So, I like to say my claim to fame is that I help build communities that create opportunities. And when I look back over the course of my career, that's exactly what I've done. But my current role, I get the opportunity to serve as the assistant dean for strategic partnerships at the Johns Hopkins School of Nursing. And then I also serve as the founder, CEO, president of DNPs of Color, which is an organization focused on increasing diversity in nursing, specifically for nurses that have their doctorate degree. And then my other hat is my nurse practitioner hat, and I serve as an acute care nurse practitioner in a surgical ICU in DC.
Wow, what an impressive resume, and your hat closet sounds like it's huge.
Very decorated, yes.
Yeah, definitely. Dr. McCamey, I know mentorship has meant so much for me, but talk to me about what it has meant for you in your career.
Absolutely. So mentorship is literally the key to success in any endeavor. And I always tell people that if you don't have a mentor, you need to stop what you're doing and find one today. And my recommendation is that you always have at least, it used to be 3, now I've expanded it to 4. So the first mentor you should have in your toolbox is someone I call mine my mama mentor, but someone that has that parental type energy where they understand you from a human perspective. They know your joys, your pains, your flaws, and your strengths. And they're able to speak to you in that either tough love or parental love type of energy that helps motivate you. The second mentor I always recommend is like your career strategist, someone that knows how to navigate the game of professional life, corporate world, and that understands your skill set and your strengths, and to help you start to cultivate those strengths and utilize that as leverage to get to where you ultimately want to be. And the third mentor is, I always say, like your hashtag goals mentor, someone that might not be as accessible in your network, but that you can watch just by the impact that they make in the world. And I think about, just to be funny, not, but just to be fun, like Beyonce or Oprah, they might be celebrity in nature, but you really value their impact. So you take notes on how how they live their life and what they put their time and talents to. And then the fourth mentor, which I just recently added because of one of my mentors attending one of her lectures, Dr. Roberta Wade from Georgetown, is a historical mentor. And this is someone that has been a prominent figure in history or in the specific area that you're looking to pursue, but they've passed on. So for me, I think about bell hooks and I think about W.E.B. Du Bois, where you're still able to learn from them, even though they've passed on. So mentorship is definitely a key. You have to have at least one, but my recommendation is 4.
I love that. What a clear example that people can go follow. I was just having a conversation yesterday with one of my former employees talking about mentorship, and not only mentorship, but advocacy. I like to kind of talk about personal board of directors, but I love the way that you frame that out. That gives just such great, criteria. So was there an experience in your life that kind of started that journey on finding mentorship?
Yeah, when I think back when I was a baby nurse, I struggled with that transition from coming from undergrad to new to practice. And I didn't realize that it was called mentorship when I was going through my new nurse experience. And the first preceptor that they paired me up with, we just wasn't a good match. Our styles didn't connect, and I was not thriving in my role. I mean, I felt like I wasn't learning and I wasn't meeting the milestones that was being expected of me. So I got the strength to advocate for myself for another preceptor. And then they ended up giving me that second chance and pairing me up with someone that not only was a preceptor but was a mentor. And I feel like there's a definitive difference when someone's precepting and mentoring. The preceptor is a little bit more in the transactional type of energy, and the mentor is a little bit more relational with some elements of transactional. So this individual, her name is Darlene Gardner. She's passed on, but I mean, her legacy lives on with everything that I do. But she was able to sit with me, learn about me as a human, and understand some of my life circumstances that I brought to my practice, and was able to speak that language that really resonated with me and helped me to find the confidence to step out there to learn. She created an environment that it was safe to make mistakes. And then she also gave me that balance of like nurturing and tough love. So she was very motivating and very strategic with how she crafted our experiences together. And it was that moment definitive moment that I felt like was like my first mentoring experience.
Excellent. And you touched on it, but why specifically do you find, mentorship, um, diversity mentorship so important in the clinical and nursing setting?
Oh my gosh. Mentorship, especially in nursing, is critically important. And mentorship for nurses of color is exponentially important because when you think about, and I'll speak to my experience being a nurse of color, we already have different ways that we've come to having access to nursing. And then you add on some of the lived experiences of racism and how to navigate that from whether you experience it from patients, colleagues. And so there's additional, I call it strategies that you have to be privy to navigate, to figure out ways to essentially compartmentalize some of those experiences to move forward, to not let it be so traumatic, but also use it as an opportunity to be resolute in your mission that you have in being of service through nursing, and then also just understanding the structures of society and inequities that show up in practice. And unfortunately, we experience. So the experience is completely different. So you need mentorship to help guide and give you those strategies on how to be successful.
Hmm. And those strategies, they're large, they're complex. Is
Yes.
there kind of an application example, or maybe kind of delve into one of those strategies in particular for our audience?
I guess a simple, I guess strategies that come to mind is just communicating when you are faced in some of these microaggression or flat out racist experiences from patients racializing you, saying they don't want, a black nurse, to, even colleagues just commenting just on, just society events. And so when I've been faced with that, some of the strategies is just really trying to look at people for their humanity, and try to look at it from that lens and be focused on your professional commitments in caring for the person. And so in some instances, you just flat out have to advocate for yourself and ask for a different assignment. So
Mm-hmm.
it can be something like that. That's the thing that comes top of mind.
Mm-hmm. Thank you so much. And the other topic that we're addressing too is in leadership in particular.
Hmm.
And with your CEO status and founder status of DNPs of Color,
Hmm.
talk to me a little bit more about that organization and the importance of mentorship there, or even what the mission is all about in leadership in particular.
Yeah, so DNPs of Color, I am just so fortunate that I get the honor and privilege to be of service through leadership of this organization. And it was created from my experience of being the only Black woman in my doctoral nursing practice program, and just wanting to have a community that understood the lived experience and how to strategize to be successful at the level that the doctoral education provides for you. It opens up so many doors. And so with DNPs of Color, our mission is to serve nurses of color through networking, mentorship, and advocacy to increase diversity in doctoral studies, clinical practice, and leadership. And I
Oh, you've
always say
got that
that's when
down. That's a
I
good.
mean,
Yeah,
it's in
one more
me.
time. That's good.
I
Yeah.
know. It's in me. And so, we were deliberate in including the mission pillars of networking, mentorship, and advocacy, because if anybody knows, your network is directly aligned with your net worth. It's about who you know. And so really building up this group of professionals, because like I mentioned before, when you have your doctorate degree, it opens up so many different doors and gets you seats at different tables. So there's lots of power in that to be able to leverage with that network. And so the second mission pillar is mentorship. As we've been talking about, literally the key to success in any endeavor. And because we have a group of professionals that are high level and in different spaces, from academia, clinical practice, policy, leadership, it really gives us that unique advantage to be able to pour into this group of professionals. And then the last pillar is advocacy. We would be remiss being a group of professionals that have been historically marginalized or racialized to not have an advocacy component to really amplify the value that we provide and the significant contributions that we make to the profession. So we are nationwide. I always say nationwide. We have folks internationally now, from Canada to Africa, to Haiti, that are invested in the community and find value in what we offer, and the mission really resonates with their experiences.
Excellent. Congratulations. And to
Thank
go
you.
international, that's so huge. And I'm sure that impact is just felt far and wide. I love those pillars. And you mentioned specifically mentorship and advocacy.
Mhm.
And, the way that I have thought about advocacy before is a little bit different than how you just described it, but it makes a lot of sense. I'm
Yes.
also curious if you kind of can think of a mentor being an advocate as well. One thing I think is that, hey, mentors, they can be that person that can be that sounding board, they can help to guide you, but to actually think of ways to advocate for you when you're in the room and even when you're not in the room.
Mhm.
I don't know if there's a question there, but, if you have any sort of thoughts or response on that concept.
Yeah, and I think that the energy with the mentorship in our group is creating opportunities. And so a large part of our mentors are of service in the mentoring capacity because they've had a lived experience either without one, or they've had one that was excellent in shaping them into the professional that they are. So a lot of the mentors offer their resources, their time, their talents to help, I would say, just toss their mentee's name in the room of opportunity. So I love that energy within our group, is that we all have come from some sort of experience where someone has either doubted us or helped us, and we utilize as motivation to help the
Hmm.
next person to not only arrive at the level that we are, but surpass us. And I think
Hmm.
that's legacy building in action, is being of service with your time, talents, and resources, but also being mindful of passing the torch to the next generation to take it further, to make it stronger, and to keep it going.
Yeah, it can sound trite, but that pay it forward mentality is so important, and
Oh my gosh, yes.
realizing, a lot of people helping everyone get to where they are, and how can you
Yes.
be that for other people. Some folks are like, how do I find a mentor? Obviously through the groups that you've created, there's a built-in kind of networking, but as you're
Yes.
either getting started or mid-career or leadership, how do you advise people go and seek out those, four different mentors that you outlined?
Yes, so I get this question a lot, and I was speaking to a group of students at Hopkins around kind of creating relationships and expanding your network. And I guess one of the many things that came out of the pandemic is that it made approaching people so much more accessible, because we're able to leverage our virtual social media, and it's acceptable. I can remember pre-pandemic reaching out to someone on LinkedIn and they would be like, "Oh, you're reaching out to me on LinkedIn? How dare you?" But now we're connecting, hitting that connect button and sending private messages and setting up meetings. So, I always encourage people to start with LinkedIn. Look at people's profiles to see if there's any of their work or their experience that resonates with you, and send a message and say, "Hey, and be transparent. I'm in the market looking for a mentor. I looked at your profile and I looked up some of your work that resonates with where I want to be or some of my passions. Would you be interested in a quick conversation?" And so that makes it easy to at least have a quick conversation to kind of gauge the energy to see if it's going to be something fruitful. And I always tell people that are in the business of mentoring will either accept you on or at least connect you with someone that might be more aligned or have more bandwidth to be able to mentor you.
Great. I want to double click. Oh no, I have to put a dollar in the corporate jargon, jar right there. But as far as being a mentee, what
Yeah.
does it actually look like to be a good mentee? It's not just about kind of, hey, calling someone and then sitting expectantly for the mentor to do something.
Absolutely. And I tell this to folks that tap me to be their mentor. And I level set with them. I say, okay, these are the expectations I have for my mentee. And this is what I impart to those that want to be mentored. Make sure that you have at least one or two bullet points that you want to present to the mentor. And then the second piece of advice I always say to them, you have to lead the relationship because 9 times out of 10, the mentor has a lot going on and you have to really set that cadence on meeting and how you want to interact and being clear with the mentor what skills or resources or energy or inspiration that they have that you're interested in also sharing with them so that they're clear on what you're looking for and that can help best guide the mentoring relationship. That's the foundation. And then from there, you cultivate the relationship so that you kind of gauge how you're going to move forward together in the mentoring capacity.
Hmm. And then similarly for a mentor, I'm sure everybody would love to take on as many people as they can, but do you have any thoughts or advice for kind of striking that right balance of, supporting and giving enough of your time away, but, maintaining your own balance with yourself?
Yeah. So me being a seasoned mentor that have a lot of mentees, for me, I go through my bandwidth checklist because I think at the end of the day, what's important for me being a mentor is that it is a mutually beneficial relationship and not transactional. The transactional relationships don't really feed my soul. And it's not, it's, I just don't like the transactional. So for me, I always, take an internal check to see if this is a mentee that energetically I can take on fully and completely with what they've come to me asking for. And then two, ensuring that I can show up as my best self for them in any capacity that's needed for their success. And
Hmm.
so if I answer no to those, then I'll say, actually, and I'm honest, I'll say, my bandwidth, or I'll even say, I feel like the skill set or the compatibility from what we've discussed um, doesn't align, but I'm happy to introduce you to the following professionals, look up their profiles and see which one resonates, and I can do a warm intro.
Hmm. That's kind, and it really does show, you are actively in support of their development, but yeah, keeping things in balance. So thank you for that.
Yes.
I guess weaving back in a little bit into, nursing specific and from a
Mhm.
diversity perspective,
Yes.
how through mentorship or through these relationships are you helping to have others create a more inclusive environment? Or what
Mhm.
guidance would you give or what advice would you give for people wanting to create an inclusive environment?
Yeah, so creating an inclusive environment requires the time and attention of everyone. And so I'm really big in aligning yourself with things that give you joy and that align with your personal mission and passion. So if you find that you may not identify as a person of color, but the mission and vision of an organization resonates with the things that you want to contribute with your time and energy, get involved. Or find opportunities to connect, to learn more, and be of service. So it's about thinking from a lens of um, imparting your knowledge because someone has imparted knowledge and time into you into the next generation. And then in terms of just fostering that diversity, equity, and inclusion, just being mindful of where you are as a person, and just taking a check around to see if you're inviting different perspectives or involving yourself in different activities, acts of service that are different from how you identify.
Mm-hmm. So important. So, Dr. McCamey, we've covered, a decent amount of ground. What have we not maybe chatted about that you'd like to share with our listeners and viewers?
I think just to touch on some of the leadership pieces, to really, I'm on a quest of like dismantling the structure around leadership, because I really feel like people think that leadership is a formal thing or sometimes doesn't apply to them. And when I think about it from the frame of being a nurse, I always want to encourage nurses that you are a leader in every aspect of the word. And because of nursing, it allows you a superpower that gives you that foundational knowledge and connection to humanity, and the ability to be able to advocate. And so I always want to encourage nurses out there that you're a leader, your impact is felt, and encourage people to take hold of that leadership energy and allow that to be aligned with your passions and missions and how you want to make an impact in your career in nursing.
What an empowering soundbite. That is so great. Thank you so much. If people want to learn more about you or DNPs of Color, where can we find you?
We're on all the social medias. Like if you just even Google DNPs of Color, our website and everything comes up, but our social media handle is DNPs of Color. I'm also available on all the social media. My handle is Dr. McCamey.
Thank you so much, Dr. McCamey. Just personally, you have such a strength and warmth about you. I can tell why you are a magnetic person that people
Thank
want to
you.
get mentorship from, and that how you really are living what you say about sort of passing down the torch. So thank you so much for your time. And thanks everybody for joining us on Elevate Care. We'll see you next time. Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com, and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.